Hi, I'm Leslie Thompson for the Plastic Surgery Channel, reporting from the 2009 annual meeting of the American Society for Aesthetic Plastic Surgery. I'm here with Dr. Jeffrey Keys, who is a plastic surgeon in practice in Los Angeles, California. Dr. Keys is the president-elect of the California Society of Plastic Surgeons and also the president-elect of the Aesthetic Society Education and Research Foundation. So, Dr. Keys, thank you very much for taking time to speak with us today.
Thanks for having me, Leslie.
Well, let's talk about rhinoplasty. This is one of your areas of expertise. And first, I'm just curious what new developments there are in general in terms of surgical approaches or techniques for rhinoplasty.
Well, you know, rhinoplasty has undergone an evolution over the past 30 years, and now currently surgeons are either performing the open or closed technique. The closed technique, there's no incisions on the outside of the nose. The open technique, there's a little incision made here, and some surgeons feel that they're better able to gain access to the structures of the nose through that approach. But skilled rhinoplasty surgeons today are able to really make the nose look quite natural, and it has a dramatic effect on the appearance because it's central to the face. So it is important, if you're seeking rhinoplasty, to get back to board certification, that you have it performed by somebody who is well trained and board certified, and especially that teaches rhinoplasty as part of its curriculum.
Are there almost like fashion trends where, you know, back in the 80s a certain kind of nose may have been de rigueur, and now in, you know, the late 2009 or so that there's a specific look that's more fashionable, or are people looking to certain celebrities for their appearance?
Well, the look that was unfashionable is the turned up Miss Piggy nose, and that's what everybody's afraid of when they have rhinoplasty. But in today's environment with skilled surgeons, that doesn't occur anymore. There's no fashion nose per se. You really want to make the nose fit the face of the person you're operating upon. So it's not the same nose on every patient. That is something that really doesn't work. So you really have to make the operation fit the patient.
And a good surgeon will, if you come in with Nicole Kidman's picture and say, I want this, a good surgeon will advise you that that may not be the appropriate size or shape for your overall facial structure. Interesting. Well, there's a new trend of ethnic facial surgeries and ethnic rhinoplasty. Talk a little bit about that and really how that differs from, I guess you would say, a standard procedure.
Well, really, you know, when you're seeing a surgeon, even the surgeons that are well trained, they also have to have an aesthetic sense. In other words, they have to know what looks good when they're performing an operation. What doesn't look good is putting a Caucasian nose on an Asian patient. You really want to maintain harmony with their ethnicity, and that's very important, and that's what most patients want. When patients come in and they ask to look different than who they really are, then I get concerned about that. So you really want to make it look natural and fit in harmony with who the patient is.
Well, Dr. Keys, thank you very much for your time, and thank you for watching. I'm Leslie Thompson, reporting for the Plastic Surgery Channel.